Medicare is a federal program that's funded by us, the U.S. taxpayers. But as you'll see in this video, the problem is there are some people that actually have to pay more in Medicare taxes than others do. Well, why do they have to do that? And is there anything that they can do about it? In this video, I'm going to show you. It takes a tremendous amount of money to fund our federal government. Right now, we have a federal budget right at $6 trillion. By the way, that's 12 zeros. That's a lot of money it takes to operate our country. But of that $6 trillion, it's interesting to note that almost half of all that money actually goes to two primary expenditures. One expenditure would be Social Security. In fact, 21% of all that money is going to go to Social Security recipients. So as you do your math on that, that is $1.2 trillion that'll be paid out in Social Security benefits. Now, there's actually four ways in which we take Social Security, so all those four ways are wrapped up in that dollar amount. But one way, and the most common way, is for someone to receive retirement benefits. That would be money received off their own work record they paid into the Social Security system. We also have spousal benefits, receiving benefits off someone else's work record that is alive. That's called spousal or survivor benefits. This means this is a Social Security recipient that actually has died, they're deceased now, and their widow or widower or even children are able to draw dependent benefits from them. And then lastly, those that are eligible for Social Security because of disability. All right, those are the four ways. So to the tune of $1.2 trillion. Now, another huge recipient of this budget expenditure is going to be for health care. This is health care that the federal government actually pays for. It too is broken up into four different programs. One of those, of course, would be Medicare. Another one would be Medicaid. This would be for low income and low assets people. And then we have a program called CHIP, which is the Children's Health Insurance Program. And then the last one would be the Affordable Care Act, that marketplace plan, as the federal government pays for tax subsidies as well as cost sharing that they're responsible for those who enroll in ACA plans. All right, and so this is actually 25% of that budget, which would be what? $1.5 trillion for these health insurance programs. But what I want to focus on today, of course, is this one, the Medicare program, which right now is operating right about $900 billion program. So the question is, how is this $900 billion program that those of you watching this are already on or will be on, how is this program actually funded? So this $900 billion program, how exactly is it funded? Let's look at the details. You're going to notice there's actually 5 different sources of funding for Medicare. We have this broken down into Medicare A, which is the hospital inpatient side of Medicare. Part B is the outpatient and doctor services of Medicare. And Part D would be self-administered medications. Okay, so these are funded differently, as you'll notice. So when it comes to Medicare Part A, look at this. 90% of the Part A program, which is what, almost $340 billion a year, the hospital side, inpatient, skilled nursing side of Medicare, is funded actually through payroll taxes. Now, what that simply means is FICA taxes. Now, of course, we pay into Social Security as part of our FICA taxes. That's not talking about this. This is actually Medicare taxes. So right now, what's happening is if you're working for someone, 1.45% of every dollar you make is going to fund Medicare, and your employer matches that 1.45 as well. So 2.90 is going into Medicare. Now, people who are high income, which would be a single filer above $200,000 or a married filing a joint return above $250,000, would pay an additional 0.9% of those income limits that are above that amount. Okay, so we're funding Medicare A through FICA taxes, through self-employment taxes. Notice that 7% of the funding of Medicare A is coming from taxation of Social Security benefits. Now, some of you would be aware that when we take Social Security benefits, some of that income is subject to income taxes. And so they call this provisional income, which is your modified adjusted gross income, plus half of your Social Security income. They take that number together and they put that to a chart. If you're a single filer, if our provisional income is below $25,000, zero of our Social Security income is taxable. Between $25,000 and $34,000, 50% of our Social Security income is taxable. And then above $34,000 as a single filer, 85% of all of our Social Security income has to be reported as taxable income. A married filing a joint return, they have a different provisional income schedule. For married, anything below $32,000, zero taxes due on Social Security. Between $32,000 and $44,000, 50% of your Social Security is taxable. And then above above $44,000, 85% of your Social Security income is going to be subject to income taxes. And that's where that is coming from. Taxes that were paid on Social Security benefits. So that's the funding on Medicare A. Let's talk about quickly the funding on Medicare B. Notice it's not coming from taxes. It's coming primarily from general revenue. Again, that's that money that we're paying in just in our regular income taxes going into the general fund of the government, therefore funding the majority of B. But notice, and this is what our video really is all about, 25% of that is coming from premiums. The majority of people that are on Medicare B are paying a premium. I'll show you that in my next slide. But some of you are even having to pay an additional amount because of your high income. We'll get into that here in just a second. All right. Now, when it comes to Part D plans, remember what this is: self-administered medications, because A and B both pay for meds, but that's professionally administered medications. Our self-administered paid through Part D. Again, 74% of that whole program is funded by general revenue. 15% is going to be funded through premiums that we have to pay for the Part D plan. And then for those of you high income, you're going to have to pay an additional amount. And then 11% is coming from basically the states through their Medicaid program as they help offset expenses for medicines for those that are on their state Medicaid plan. And they will actually forward those from their state budget into the federal budget. All right, so that's the funding sources of Medicare. Now what we're going to talk about are these right here, these premiums that we have to pay, what some have to pay and why some have to pay more. Hey, Medicare can be very confusing. In fact, people make mistakes all the time because of how confusing it is. So what I've done is I've actually created a Medicare, notice this, Essentials Workshop, where you have the opportunity to really learn everything that you need to know about Medicare so that you can make Medicare decisions. There are thousands of people every month that watch this workshop, and we get lots of reviews saying that this is something that really was helpful to them. And so what you can do is down here below in the comments section, you'll see where it says pinned comment. At the very top of those pinned comments is a link. And you click on that link, what we're going to do is we're going to give you free access to this Medicare Essentials Workshop. And we want you to watch it because we don't want you to make any mistakes. Okay, I want to begin by just talking about Medicare A and B. We call this the original Medicare. A is called hospital, which is the inpatient side. B is medical, the outpatient, as well as doctor services. Now for Medicare Part A, we've been paying into that all of our life. We pay those FICA taxes, and because of that, there's a zero premium for most people. As long as someone has 10 years worth of taxes paid in, we call that 40 quarters, then there's zero premium. If they have less than 40, we try to get that from a spouse, either existing spouse or deceased spouse, or even a divorced spouse. And if we can't do that, then they have to pay for their Medicare A. Most people don't, though. We have a zero premium for A. Now, B does have a premium. Now, the B premium is reset every year. In fact, last year in 2022, this was $170.10. It went down to $164.90. And this is a monthly premium that we pay for Medicare Part B. If you're on Social Security, comes out of your check. If you're not, they'll bill you quarterly, or they'll set up some kind of an auto pay through what's called Medicare Easy Pay or through a mymedicare.gov account. But all of us are going to have to pay for our Medicare B unless we qualify for Medicaid, which is not very many people, but those who do, they actually can have the state will actually pay that expense. All right, so what I want to try to teach you about this, though, is that number is not just some random number that Congress approves. What this number is, this came about in 2022, so last year. In 2022, Medicare projected what they believe it would cost them to cover the average Medicare recipient in 2023. Again, they have to project the billions that will cost them to cover everybody under B, divide that by the millions that are on Medicare, and they come up with a monthly number. So in 2022, they projected for 2023 that it was going to cost them $660 a month to provide Medicare Part B benefits. Everything outpatient, all doctor services, durable medical equipment, preventive services, home health care, all those things covered by B, they said it's going to cost them $660 a month on average. And so what happens at certain income levels, people have to pay 25% of that amount. That's how they came up with the $164.90. Okay, and so what happens is the people that are on Medicare B at a certain income level, they pay 25% of that number. And so the income numbers we call thresholds. So if we are a single filer, $97,000 or less, modified adjusted gross income, it's called MAGI, modified adjusted gross income, which is line 11 plus line 2A on your tax return. You can look those numbers up, have your MAGI. $97,000 or less, you pay $164.90. A married filing a joint return, $194,000 or less, modified adjusted gross income. Again, those two lines together, and if we're below that, then we pay $164.90 a month. So you're paying 25% of what it costs the government to cover you. But those people that are higher income, notice we put over here a plus sign. About 10% of the population will pay more. And let me show you how those that have to pay more, why they have to pay more, and how those calculations come about. Now we call these additional amounts, notice an acronym IRMAA, and it stands for Income Related Monthly Adjustment Amounts. Now you'll notice this says 2023, and why? Because the 2024 numbers are not out yet. We're expecting them really any day now, certainly within the next couple weeks. I'm sorry we don't have those, but they haven't put them out. Normally by this time of the year we would have those, but they'll come out, and there are going to be some slight adjustments. I've been reading on this. Some think that 97 is going to go to 102. Some say maybe 105, which would mean the couple would go to what? If this is 102, it'd be 204. This goes 105, couple be 210. And so we're going to certainly see some increases. But as long as we stay below these numbers, all we do, we have no IRMAA, we just have to pay that $164.90. Remember, we're paying 25% of what it costs the government to cover us. We said that was $660 a month on average. So you're paying 25% of that expense. But as our income goes up, now they're going to add to our Part B. We call this the base premium or the standard premium. We call these IRMAAs. And so these are going to be added, right? So if we have somebody that's down here and they're at $250,000, married filing a joint return, they're going to pay $164.80 IRMAA plus the base of $164.90. And so what's happening when they're adding these IRMAAs? What's happening is you're paying more and they're paying less. At these income levels, you pay 25, government pays 75. At this income level, you're going to pay 35% of the cost, and Medicare covers 65. Here, it's 50-50. Here, you pay 65. Here, you pay 75. Here, you pay 85%. And so what happens is with the higher income, they're saying, we're not going to offset your expenses as much. And again, I know if you've never heard of this before, it's a little bit discouraging, but I always remind people, this is definitely a first world problem. If you have this problem, it is one of those good problems to have. Okay, they're not taking it all. Could be disappointing, but the point is, yes, we've paid a lot in through taxes, all of us do, but now those of us who are high income are even going to have to pay more. So now notice though, not only does my high income affect my Medicare Part B, that outpatient side, but also is going to affect my Part D plan. Now, Part D plans in most zip code, there's going to be anywhere from 15 to maybe 25 options or more in huge metro areas. A Part D plan are those plans that we buy for self-administered medications. Medications that we take in the hospital or outpatient are covered by A and B. But here it's the drug plan. Now, drug plans are going to vary, lots of options, but on the low side, we're going to see a drug plan about low side about $7 a month, high side maybe around $70 a month. There are a few that'll cheaper, a little lower, but that's kind of the range. And the average drug premium right now was in that $30 range. And the difference really is the formulary. The medications you take will determine what plan you need to be on, and how many you take will determine that. But the point is we have a monthly premium. But if I'm at these income levels here or less, what? I don't have an IRMAA. I just pay the drug plan, whatever the premium is. But if I am high income, they're going to add an IRMAA to my drug plan as well. So let's go back to the 250 example. I have 250 modified adjusted gross. Let's say it's husband and wife. Each of you would pay an additional $164.80 plus your base of $164.90. And whatever drug plan you're on, whether that's $30 or $10, they're going to add that $31.50 to that. So what's happening? The government again is saying, up here at this income level, we're going to offset more of your expenses. As your income goes up, you're going to be paying more for your drug plans as well. All right. And so again, these IRMAAs are going to be assessed. Now, keep in mind, if I'm going on Medicare in 2023, they're looking back at 2021. If I'm going on Medicare in 2024, they're going to look back at 2022. They always look back 2 years, and they adjust these numbers on an annual basis. So one year you have an IRMAA, and the next year you don't. It just depends, but they're always looking back to establish what your Part B and your Part D premiums will be. Now, keep in mind, there are times when we have life-changing event. You'll see in the next slide, there's 8 possible life-changing events that will allow us to appeal these surcharges, these IRMAAs. And I've had people that may be at this IRMAA level, but because of a life-changing event, it moved down 1 or 2 or maybe all the way down. If we can eliminate it, that's awesome. Or if we can just go down a stage or 2, we'll eliminate some of that IRMAA that's going to be assessed. Hey, if you've come to the place where you know you're going to have to make some Medicare decision pretty soon and you want to make the right one of the best ways to do this is to go down below, and you'll see in the comment section there, the very first pinned comment at the top. You can actually click on a link there and you will book a call. And you'll book a call with one of our Medicare guides. All the guides with our company, I have personally trained them. They're professional, they answer all your questions, and they'll show you your Medicare options so that you'll be confident in your decisions. Let's get back to the video. So here's the process we call appealing the IRMAA. We have to use a form called an SSA-44. You can find these online. If you work with us, we'll do all this for you as well. But we have 8 possible life-changing events. You cannot add to the list, folks, okay? You cannot make up your own life-changing event. It has to be one of these 8. And the life-changing event must occur before you can appeal the IRMAA, and that date that occurs has to be in the last 2 years, because they're always looking back 2 years. We can use the same event for 2 years, and husband and wife can actually use the same event as well because they filed a joint return. So let's go through them real quickly. Marriage, this could be somebody that has an IRMAA as a single filer above the 97,000. They get married, and together as a couple, they're below the 194,000. We would mark marriage, put the date of marriage, as long as in the last 2 years we can appeal, and we have to provide proof with the marriage license. If there's a divorce, obviously that can easily affect income, and so we put the divorce date down. We supply a divorce decree, and we can appeal the IRMAA and we'll win. Death of spouse, that would obviously change as well. Work stoppage means you totally retired. What's the date you did that? Work reduction. Now this is an important one because work reduction, they don't ask you how much you reduced. You could be working 40 hours. Now you just went to 30 hours or 35 hours. If that reduction has affected your income, then you have an appealable right. Loss of income producing property means that you lost that property, means it burned in a fire or it went down a mudslide. You no longer have it available. Not that you sold it and took a loss, but it's no longer there. Loss of pension, the pension plan that went bankrupt, no longer receiving that income. Same thing with employer settlement payment. And so we have these 8 appealable issues. If this applies to you, you put the date in here, and then what we'll do is you can do this. And again, I'm shooting this video September 2023. So if I was appealing a 2021 IRMAA, I could put in my 2022, exactly what it was. Remember, adjusted gross income is your line 11 on the 1040, and line 2A is your tax-exempt interest. Put those two together, how you file your taxes. Or what we could do, we could actually project for 2023 and give them those numbers. Now, you want to be accurate as you make those projections, but they will look at those new numbers, and if we're moving down the scale and we're having less modified adjusted gross income, they absolutely will approve your appeal. You'll win that, and you'll see those IRMAAs either reduced or totally eliminated. Now keep this in mind. It's well worth your time to do this because those IRMAAs, you can see, are sizable, and they're going to continue on unless you appeal. And if you work with us, we'd be happy to walk you through this entire process.